This video we're going to talk about the supraspinatus rotator cuff muscle and its corresponding tendon. This is the most commonly injured rotator cuff muscle. So I'm going to show you a little bit of the anatomy, what it does, how to test for it at home, and then some tips to try to improve your range of motion, pain, and strength. The supraspinatus muscle is one of 4 rotator cuff muscles. It runs across the top of the shoulder here, goes over and attaches on this outside ball portion known as the humeral head. So this is going to be a right shoulder, so I'm going to flip this around a little bit so you can see. This is a supraspinatus. It's running across right here. It's called supraspinatus because supra means above, and that's the spine of the scapula. And then you can see how it travels underneath here. It's going to travel underneath this bone and attach out here. Now with supraspinatus pathology, this can be from a degenerative change over time, just wear, tear throughout this area, chronic use, overuse, repetitive strain, or this can be from one particular incident. Maybe you fell, or you were going to fall and you caught yourself and you strained and pull your shoulder, and then that caused a tear of the tendon here. Now this tendon is avascular, so it does have a poor blood supply, and so it tends to heal a little slower than, say, one of the other 3 rotator cuff muscles. This one can definitely be tricky to treat. The recovery from this one, even after surgery a lot of times, is a little more in depth, a little more complicated. It is doable, and I've treated a lot of these over the years. So I'm going to show you how to evaluate to see if you maybe have this condition going on, and then some things you can do to treat. One of the main things you may notice if you have a tear in this supraspinatus rotator cuff tendon, or you have irritation, you may have difficulty bringing your arm out to the side, reaching out in front of you, or even putting your hand behind your head or out to the side, maybe to grab something off of a tabletop or something. You may notice this pain that you have on the outside of the shoulder. It may radiate up to the side of the neck. It can radiate down the arm into the hand. And so that's just a very common presentation of this tendon and its corresponding muscle when it's injured or irritated. The first test that we're going to perform is going to be called a drop arm test. Now, one of the main functions of the supraspinatus muscle is to bring the arm and hand out to the side, so kind of like this. And it also stabilizes the shoulder joint. It helps with rotation depending on the position of the shoulder. There's several things that it can do, but at the end of the day, that is one of the main functions, is to help bring the arm out to the side. Now the deltoid, the big shoulder muscle, does a lot of that movement. The primary aspect of that movement is performed by the deltoid, but the supraspinatus does have a large contribution, most especially at this lower portion when the movement first starts to occur. This test is designed to be performed with a clinician or someone that's trained to be able to do it, but if you don't have someone, I'm going to show you an easy way to check it yourself. So you're going to take a piece of PVC pipe or a walking cane or broom handle, whatever you have. We're going to say it's my right shoulder that's affected, so I'm going to grab the end here. We're going to use my left hand to bring my right arm out to the side, and now what I'm going to do is kind of take some of that pressure off and see if I can hold my arm out there. Now I'm not going to remove this completely because I don't want it just to drop, but I'm going to see if I can hold it out there. And if I can't hold it out there, if it drops, then the test is going to be positive. Or if the person really tries to hold it up and they develop this shrug sign where the trap muscles really kicking in to try to hold that up, then the test is going to be positive. And likely you do have something going on with your supraspinatus muscle and or tendon. That's not a guarantee that it's torn, but it's definitely irritated, not functioning like it should. This test is going to be called the full can test. So what you're going to do is bring the arm out to the side, and not straight in the front, not straight out to the side, kind of in this what I call half and half position out here. So you're going to bring your arm out here. You're going to take a strap. This can be a belt, it can be whatever you have that you can use. I'm going to put it just above my wrist here, my forearm, and I'm pulling down with the strap, and I'm trying to bring my arm up towards the ceiling. So I'm going to pull down, trying to bring my arm up. You can see that position there. And if that reproduces pain in that shoulder joint, most especially here on the outside, it may radiate down the arm, it may radiate back up to the neck, then that test would be positive and would indicate pathology that's possibly occurring within the supraspinatus tendon and or its muscle. Now we're going to look at the empty can test. So similar to the full can test, we're going to go in that same position known as the scapular plane. So kind of out here, not straight in the center, not straight out to the side, kind of about 30 to 40 degrees. And I've got this strap around my forearm here. What I'm going to do now is turn my hand so that my thumb is pointing down. So I'm emptying a can. Now this test can be a little difficult, and especially if this is a really painful shoulder, you may not be able to perform this at all, just getting into the position. So now what I'm going to do is pull down on that strap, and I'm trying to bring my arm up towards the ceiling. And if that test reproduces your pain symptoms that you're having in and around the shoulder joint, with or without radiation up or down, then that test would also be positive. So now you determine that you likely have supraspinatus pathology going on. let's start treatment. Range of motion is really important to be able to restore range of motion, both reaching out in the front, going overhead, and or reaching out to the side. So you're going to take that same cane or PVC pipe or whatever you had that we initially used for the testing, and we're going to say it's my right shoulder that's affected. I'm going to grab a hold just like this. I'm going to bring this up as high as I can and then come back down. And it may kind of look like that. The affected side may kind of drag behind. That's okay. You're going to go as high as you can, using the left arm or the unaffected arm to bring up the affected arm. And I would complete somewhere between 2 to 3 sets, 10 to 12 repetitions, several times a day. Now we're going to work on shoulder abduction using the cane. I'm going to grab a hold here on the end. I'm going to take the cane. I'm using my left arm to do most of the work here. I am trying a little bit with the right arm to help, but if it's too painful, just basically let the unaffected arm just do all the work, bring it up. And I'm going to complete 2 sets, 10 to 12 repetitions, several times a day. For the first 2 weeks, you're going to continue working on that cane movement in the front and out to the side, increasing your repetitions and how many times a day that you perform that movement. And then we're also going to start during that time on day 1 some isometric exercises. Now isometrics is going to be where there's a muscle contraction but there's no movement, so it doesn't over irritate the joint too much when you're really trying to start loading the tendon and loading the tissue. You're going to take a towel. It can be a hand towel that folded over, it can be just a regular bathroom towel, whatever you have. You're going to put that against the wall and you're going to bend your elbow at about 90 degrees, give or take. So what I'm going to do first here is going to be external rotation. So when I contract, I'm thinking about contracting those muscles on the back side of my shoulder, and I'm bringing my hand out just like that. So that's what I'm going to do on my affected side here. I'm contracting, I'm pushing my hand out. A lot of people mess this up, although this is another exercise we're going to perform, and they try to bring the arm straight out to the side. This exercise is designed to work the posterior cuff, the muscles, and the tendons on the back side of the shoulder. So you're working on trying to bring your hand out to the side. So I'm going to do that. And I'm going to repeat that for 2 to 3 sets for about 5 repetitions. And I'm going to hold each repetition for about 5 seconds. You don't have to get super bogged down with that, and try to remember that. If you forget, maybe just do 10 reps, hold each one for 5 seconds, maybe 25% effort, relax. I'm pushing out again, maybe 25% effort, about 5 seconds, and relax. You should feel that on the back of your shoulder. And that is shoulder external rotation and an isometric exercise. Now we're going to perform shoulder abduction. So you're trying to bring the arm out to the side. Now this is basically going to be the one that I was just talking about. A lot of patients try to bring the arm out to the side. So that's what you're going to do here. Keep the elbow out straight all the way. I'm going to push into this the same way. Hold about 5 seconds. Maybe I'm repeating this for 10 repetitions, whatever that is. You don't really have to get super specific with that. At first, at the end of the day, this is just about loading that tendon, putting some load through it, contracting the muscle to kind of start everything back to working properly. And you're going to do that pushing straight out to the side, and do that several times a day. This is going to be internal rotation using an isometric. And so what you're going to do is elbow by the side, it's bent to about 90 degrees, and you're going to try to bring your hand in towards your abdomen. So you're going to put that towel here on the door facing, got my hand like this, and so I'm contracting. I feel that in the front of my shoulder here pulling in, and I'm going to relax. I'm going to hold that each one maybe 5 seconds, repeat that for 10 repetitions, or really whatever repetition scheme you want, and just repeat that several times a day. Now we're going to use this exercise band to perform internal rotation. So the elbow is going to be by my side, and I'm going to work on pulling my hand in towards my abdomen, keeping the elbow tucked in nice and tight. And I repeat this for 2 to 3 sets of 10 to 12 repetitions. I would usually have my patients start this exercise and the next exercises using the band after about the first 2 weeks, depending on how you're feeling. So if you're feeling some better, you feel like you're gaining a little more range of motion at reaching, you can go ahead and start including the band exercises. And I typically also have my patients continue with those isometric exercises where you're just pushing against the wall where there's no movement for a couple of more weeks, so maybe over the course of 4 weeks, even after I've started using the bands after week 2. Now we're going to work on external rotation. So I'm going to flip over to the right shoulder just for camera purposes. My elbow is by my side and I'm pulling out, just like you're opening a door, opening a gate, and you're going to bring your arm out. Now the trick with this is a lot of times people end up, they don't keep their elbow bent and they bring it out to the side, or they end up kind of doing this movement. You want to keep the elbow tucked in and then bring the hand out. If you have trouble keeping the elbow tucked in, you can take a washcloth or a towel. You can put that between your elbow and your side to kind of hold on to it, and then you can do that movement right there. So go through 2 to 3 sets of 10 to 12 repetitions. Now we're going to work on shoulder abduction, bringing the arm out to the side. I have my band here fastened out the bottom of the door, and so what you're going to work on is trying to bring the arm out to the side just like that. You're going to feel that muscle contract on the outside of the shoulder. You may feel it across the top, and it's normal to have some pain with this. In fact, I don't expect you to be pain-free while you're going through your program. If you are, you're really not increasing the load enough to make a good effect and really improve your status of the rotator cuff. I'd repeat this exercise for 2 to 3 sets, 10 to 12 repetitions. For this last technique, we're going to use a kettlebell. You can use a dumbbell. And what you're going to do is perform pendulum exercises while using this kettlebell. Now, a lot of times you start pendulum exercises when you first are going through your post-surgical recovery, or maybe when this is a really inflamed and irritated area. I like to use this technique, especially because of the weight, for a little bit of pain modulation in the area in the shoulder that hurts. So what you're going to do is take the kettlebell, you're going to let it just kind of hang here. I'm going to support myself with my unaffected arm, and what I'm going to do is kind of use my body to swing back and forth, just kind of back and forth like a pendulum, and then we're going to go front and back, just kind of letting that weight, just kind of after you get going, let the weight do most of the work. You're going to have a hard time keeping the shoulder muscles out of this. A lot of times I like to tell patients, don't use your shoulder, try to use your body. That's very difficult. So I go front to back, and I may do that for 30 seconds. I may go side to side for 30 seconds, and then I may make circles depending on how I feel. The circles sometimes can be uncomfortable, clockwise and counterclockwise circles, so you have to be careful with that one. But I definitely would go front to back and side to side. A point to make with this is to make sure that you're not standing up too much when you're doing this. You want to kind of lean over so that you're optimizing, gravity and the range of motion that you're trying to achieve. Thanks so much for watching this video. I hope it helps improve your pain, range of motion, and strength that you may be having deficits in related to supraspinatus pathology. Thanks again.